I think it is so important that we have healthcare professionals and experts running for office, especially in this environment where we have people who don't believe in public health or aren't experts running so much of the healthcare infrastructure, at least at the national level. We desperately need you. You can do this. You can still be a doctor and serve on your local school board or your city council or even your state legislature. Run for Something has worked with so many healthcare experts over the years. If you do this, you can affect not just the health of your patients, but the health of your entire community, or bigger.
This is the Visible Voices podcast. I'm your host, Dr. Resa E. Lewis. In today's episode, I cannot wait to bring you my conversation with Ms. Amanda Litman. You may know Amanda as the president and co-founder of Run for Something, co-founded in 2017 with Ross Morales-Roquetto. Run for Something is a multi-million-dollar political organization that recruits and supports millennials and Gen Zers running for local office. Amanda, welcome to the Visible Voices podcast.
Thank you for having me.
What I'll say is you quote candidates, open slots, boards, and other state legislative positions for which to run the way someone who reads the sports pages can quote sports stats. Where did that come from?
I've always had a pretty good memory, but also I've been doing this work now for over 8 years, and it's as embedded in my brain as the Eminem lyrics I knew as a teenager. I'll never unknow sort of the fact that there are about 1,300 counties across the country that elect coroners, or that this year there's about 98,000 elections up, most of them between February and July. I don't know. It's just part of the language that I speak now.
Where are we right now? It's Q1 2025. What do things look like in terms of slots, candidates, and what Run for Something is doing in terms of prepping people to run for office?
Since Trump won back in November, we have seen record numbers of people signing up to run for office. My expectations by the time this airs, we will already have had the most number of people sign up in the last 6 months that we've had since the entire organization began. We're averaging hundreds of people a day thinking about running for office. Now, will it ever be enough to fill every office? I hope so one day. But right now, our goal is to build as big of a top of funnel as we can, knowing that at this point, most of the people signing up with us are probably going to run in 2026, which is good because based on the way the political landscape is shaking out, 2026 is an opportunity for Democrats and anti-fascist leaders to win big. It could be a landslide election in any number of ways. So we should fight everywhere to have the opportunity to win in unexpected environments.
Where are you right now, would you say, for maybe some people who are not feeling so optimistic about the state of the world? There seems to be a positivity about what you just shared.
Well, I think in order to do political work, you have to be an optimist. Even if it's like a pessimistic optimist, you have to think change is possible. You have to think that things can get better eventually, or else it's impossible to get out of bed in the morning and do this work. And I have now seen this over the last nearly decade of what happens when normal people, everyday people, do a really extraordinary thing of putting their name on the ballot. I've seen people win in deep red places. I've seen people run and be the first of their community or their party to get on the ballot in that district, sometimes ever or in decades, and win. I've seen, a mom of twins who were in the NICU in the beginning of her campaign go on to win in a deep red place after knocking doors every day for months and months on end and visiting her babies in the hospital at night, and then go on to expand Medicaid in Virginia. Jennifer Carafoy, to be specific, who went on to expand Medicaid so that 700,000 Virginians had access to health care, so that no family would ever hurt the way that her kids did. I think about the people we've worked with over the last 8 years and how could I not be optimistic? I've seen what's possible.
Your upbringing, your family, was it one of political engagement and civic engagement?
I grew up in the DC suburbs, so politics was sort of the air we breathed. But no one in my family works in politics. My dad was a lawyer. My mom was a stay-at-home mom for a while who ultimately went back to school to become a PhD in economics. I'm the oldest of 4, and we're very, very close in age. None of my siblings work in politics. I had a best friend in middle school and high school whose mom was very politically engaged, who used to take us to protests and to knock doors. We went to a pro-choice Virginia rally when I was in probably middle school, early high school. We'd go knock doors for Virginia Democrats, which in the late 90s, early 2000s was kind of long shot effort. Um,
I love these seeds, though, that sort of led you to where you are. Medicine, healthcare, physicians, there's something that we're taught, we're socialized to, quote, not be political. Medicine and healthcare and taking care of people, that's not political. We both know, though, healthcare and medicine has become politicized.
Mhm.
And I actually have seen this awakening, and I hope for a continued awakening for people in healthcare. Let's, for sake of ease, just say physicians becoming more involved, becoming more vocal. And I'd love to hear, where you think physicians, early physicians, I guess if they're going to be younger in their age and stage, to get involved in politics and to run for something.
I think it is so necessary to have healthcare professionals of all kinds running for office. Um, Especially, I think this came to light during COVID, but has been true ever since and before. We need experts from all backgrounds to serve an elected office, um, especially these state and local offices, which are not full-time positions. Now, we definitely need more doctors in Congress, but we've worked with physicians, nurses, healthcare experts, masters in public health, the whole gamut, who have run for things like state ledge, city council, school board, library board, who have used their expertise to better govern.
Yeah.
I think about Dr. Megan Srinivas, who's an infectious disease expert and a doctor in the Iowa state legislature. She won in I think either 2018 or 2020. I don't remember off the top of my head. But she's still serving. Expertise has made her a better legislator. It makes her a better expert when evaluating the impact on public health. It makes her better at communicating out science and making sure that her knowledge and her background are brought to light in these hearings on public health issues. I think it also makes her a better doctor of really understanding the way that public health and the way that government affects the quality of life for her patients.
Do doctors act differently? Do they stand out when they're the ones running for office? Are they different than other people running?
They often have very specific lived experience, stories of their patients, obviously anonymized, that helps inform why they've run, the sort of social health uh, and environmental health context that people are living in that bring them into their doctor's offices, that really inform, like, this is a problem that I cannot solve as an individual, that as a health expert, I can't fix from my clinic. I need to fix it on a system-wide approach. I think
Yeah.
that makes them really compelling candidates.
Yeah. And good storytellers.
Mhm.
Yeah. I believe health is, umbrella, physical health, mental health, emotional health, social health, financial health, and
Mhm.
definitely civic health. You've mentioned library boards as really important and a good way to get in. And I'm curious.
I love library boards. I wish New York City had an elected library board because it's the one position I'm like, I would run for that. For what it's worth, the Brooklyn Library Board is appointed. Um, so library
Not that I've done
boards,
my research.
of course I have. So library boards are such an incredible values place to live your values as part of your community. In many places, library boards quite literally govern the budget of the library. Sometimes it's decided by municipal governments. Sometimes the library board shapes it. They do things like hire and fire librarians or directors of libraries. They run facilities. They run programming. They often shape what books are ordered or what kind of events are held. But they've really become the focal point over the last couple of years as we talk about book bans, as we talk about access to books, especially for younger kids and for teenagers. We worked with a library board. I think she's still technically a trustee, Dr. Katie Clark in Altadena, California. She's I think she's a PhD, not a medical doctor. But she once explained to me the library holds the meaning of the community. You think about it, it is one of the true places and one of the only places where every age group, every background, every class, every ethnicity engages with government. You think about the parent that brings their kid to story time, like I bring my kids to story time nearly every weekend, the new citizen who goes to learn English, the senior citizen who goes for knitting circle on Tuesday nights, the person looking to apply for a job who goes and use the library resources. It holds the memory and the future of that community. It's the third space that people so badly want. Libraries are amazing. And
Yeah.
there's a reason that, the right and the anti-democracy folks are trying to take them down, trying to undo them. It's like a joke online. If somebody tried to invent a library today, you wouldn't be able to. You wouldn't be able to get the public will. They must be protected. They must be fought for. And the way to do that is to run for the boards that oversee them.
Yeah. One other board that caught my attention because it's, well, healthcare related. What is a coroner elected?
So in about 1,300 counties across the country, coroners are elected positions. They, as you can imagine, investigate deaths. They issue death certificates. This became a really big issue during COVID in particular, where coroners who were anti-COVID or anti-vax would not put COVID on death certificates, undercounting deaths. We also ran into this, in particular, worked with a candidate in Colorado who's running for coroner, specifically around the issue of trans dignity after death. The incumbent coroner, I believe, the Republican who was running for coroner, wanted to misgender people after death, putting the wrong gender on their death certificates. This has a direct effect on statistics and the way that you then implement prevention measures. And trans people are disproportionately affected by things like both homicide and suicide.
Yeah.
So it was really affecting the way they were allocating resources. The other position that I'm not sure if you've talked about here is hospital board.
Tell us more.
So hospital board is a really interesting position. It's not everywhere, but in places with public hospital systems that are governed by elected hospital boards. There's a lot of these in California. There's a bunch of these in Florida. In particular, the Sarasota Hospital Board has been a really big hotbed for far-right activity. You'll have literally anti-healthcare people running and winning positions who then try to either privatize the hospital system, ruin patient care, make it even worse for doctors, nurses, and staff to work in these places. It's a really dangerous office for someone who doesn't believe in public health to take. And it's something that obviously the right has spent a lot of resources in investing in.
For listeners that aren't completely familiar with Run for Something, what it can do, your book actually walks them through running for office, who should run for office, why they should run for office. And, this mission of getting younger people, women, LGBTQI plus people really running. It's a beautiful mission. It's an important mission.
But if you sign up with Run for Something at runforwhat.net, you'll start to get information from our team. We do regular calls, we do trainings, we have a ton of resources at this point explaining everything from what local offices actually do to how to get on the ballot, what to do once you're on the ballot, how to write a campaign plan, how to raise money. We will talk you through every step of the process. What I like to tell folks is that the only qualifications you truly need to run for office, besides some places have residency requirements, you probably need to be a citizen, that kind of thing, is you need to know the problem you care about solving, how the office you're running for would give you power to solve it, and why voters should want you to win, which is different than why you want to win. You want to win because winning is great and losing sucks. Voters want you to win because you're going to do something really specific for them. If you can answer those three questions, basically everything else about a campaign is logistics. And you can learn logistics, and we can teach you and help you through the logistics.
How are you different having written book one?
Run for Something was my first book. I wrote it in a fugue state in 2017. In like 3 or 4 months, I think we started it in February. It came out in October. So it was really a crash. And it was the first time I ever thought of myself as a writer, which was a cool thing. Like I've always loved writing. It has been so meaningful to me. It's my favorite part of the work I do. That's what email writing was. But to sit down and write a book is the first time I ever got paid for writing that wasn't like ghostwriting for email. And was the first time I could ever think of myself as this is something I do and is part of who I am. So that was really helpful in sort of shaping, honestly, the last 8 years of, no, I'm an executive. I'm a political strategist. I'm a boss. I'm a leader, but also I'm a writer. And that's part of who I am too.
It's actually a perfect time for me to ask you about your voice. When do you think you realized you had a voice, and when did you start using that voice?
Oh, what a thoughtful question. I think when we started Run for Something, the Run for Something was born of the ashes of the 2016 election. I worked for Hillary for 2 years. About a week or so after Election Day, I started hearing from people I'd gone to high school and college with who wanted to run for office and didn't know where to go. And I was the person they knew who worked in politics, so they asked. We wrote a plan along with Ross, my co-founder, and we built a website and we launched Run for Something on Trump's first inauguration day. And I had never talked to a reporter. I had never been a public person. I had, I don't know, a couple thousand followers on social media just from like the years of doing campaigns, but it wasn't a big part of my life or my job. And a very quick realization that I was saying something that people needed to hear. And like I have this app on my phone that shows me photos. I'm trying to clean out my like digital library. And so I have this app on my phone that every day shows me every photo on my phone from the last, I don't know, 15 years from that day. Cause I'm trying to delete the hundreds of pictures of my dog I have, whatever. And, um, and I took screenshots of these over the years of emails I've gotten from people or messages of, you know, I saw a thing you posted on social media. I'm running for office. I'm not applying for Representing's endorsement. Like, I'm not eligible. It's not the need. I don't need the help. But like, I wouldn't have done this if I hadn't seen that, or if I hadn't heard this interview you did. And that to me has affirmed for me that like, no, doing this matters. Speaking out matters. Asking people to do this really, really matters.
Yeah.
Even if that's the only way we engage.
Yeah. I just got the chills. I love that. Yeah. This concept of rest and deliberate rest, in the medical educator world, they talk about deliberate practice, and, reading, learning, and applying real time. And I was really resistant to this concept of the importance of sleep and rest. And I thought, 12 hours was a direct correlation with 12 hours of productivity. And then you realize, actually, no. The more you do this deliberate rest and do all the things that energize and are healthy, when I get back to work, there's a much better focus, much better productivity in a much more time efficient period, which also leads us to the 4-day work week. Go.
So Run for Something has a 4-day work week. It rules. It is the only way I've been able to do this work for 8 years. It's been even more necessary now that I have kids, in that I am very lucky and grateful to have 5-day childcare. So, because sometimes I do stuff on Fridays, but Run for Something treats Friday like a weekend. And most of the time you don't work on weekends. And it has been so helpful. It was very hard at first. I'll say onboarding to it was challenging for both me and my team. You sort of have to adjust your pace and your deliverables, how you think about your time management. But I will never work on Fridays again. It is a revelation for how you can get stuff done in the time you have available for you. And it's a thing that I heard over and over again from the more than 130 leaders I talked to, including doctors and medical professionals, where, the whatever it is, 100-hour residencies, like, did that really make you a better doctor? Did it make you more trained? Or was it just the suffering that everyone had gone through in the past that now you have to go through too? Would it be better if not a 4-day work week, something more humane, something more compassionate, more balanced, to get to the same place?
I'd love to hear your take on onboarding, its importance, and re-onboarding.
So onboarding is so necessary because it sets the tone. It's like the invitation you send to the party. It's the first real introduction you have. It's your first 3 dates, for example, with your new work or your new team. The way that you onboard people helps put them in the mindset you want them to be as they join your culture and your community. Now, re-onboarding is a thing that I was taught by someone I interviewed, KP Trueblood, of having your team regularly all go through this reintroduction, both because things change, but also because it's a really good chance to level set. So we're actually doing some re-onboarding with Run for Something over this year to make sure we're all aligned on who we are and how we operate and what has changed over the years and what hasn't, and like really understand people's roles, because I think it is easy, especially if you've been together for a while, to sort of like atrophy away from who you want to be, and re-onboarding gives you a chance to have that formal conversation.
I just giggled because you used the word atrophy. Good word. Good word. Self-care. And that industries, be it healthcare, be it politics, be it education, be it law, fill in the blank, these industries don't model, loud, honor self-care. And, in medicine, as you highlighted, it's like strong if you don't have to sleep. Even better if you can go a shift without eating. Don't call in sick when you're sick. And it's messed up. It's really messed up. So going back to millennials and Gen Zers, generationally, people are much more like, no way, boundaries. I like to take care of myself, or I need my downtime.
My sister is a second-year resident in Texas. She's an OB resident. Hard place to be an OB resident. But she's working around the clock these days, as you can imagine. And we will sometimes FaceTime her so that her nieces can see her. She'll be like, yeah, I've been in the hospital for, 36 hours or I've been on call. And I am so grateful for that kind of training. I'm sure that in many ways it's very useful, but it is hard for me to see someone I really care about. I love my sister, to go through that and to know that like there's no way around that. That can't be making her a better person. It's certainly not making her happier. even if she loves the work that she's doing.
I'd love you to leave the audience with one thing, just one thing they can do if they want to up their political engagement, their civic engagement, and helping to create a healthier democracy.
My obvious answer here is run for office. I think it is so important that we have healthcare professionals and experts running for office, especially in this environment where we have people who don't believe in public health or aren't experts running so much of the healthcare infrastructure, at least at the national level. We desperately need you. You can do this. You can still be a doctor and serve on your local school board or your city council or even your state legislature. Run for Something has worked with so many healthcare experts over the years. If you do this, you can affect not just the health of your patients, but the health of your entire community or bigger. It can be transformative. Now, if you can't, if for whatever reason this isn't the right time for you, think about how you can get involved in local politics in particular. It is going to be so important in the next couple of years that we have really strong leaders at the local level, both to mitigate harm and to advance progress. And the best way for you to do that is to knock doors, make calls, give money to the people running for the kinds of local positions that affect your day-to-day life.
The Visible Voices podcast amplifies voices in the healthcare, equity, and current trend spaces. Our team includes Dr. Giuliano DePortu and me, Dr. Resa E. Lewis. Find me at Resa E. Lewis MD on social media or visit thevisiblevoicespodcast.com. Find us wherever you listen to podcasts and watch our episodes on YouTube. This podcast is for education and entertainment purposes only. The views and opinions expressed by our hosts and guests are their own and do not reflect the opinions of their institutions. Information shared here should never substitute for clinical judgment or for medical advice. Together, we're making healthcare more equitable, one visible voice at a time.